Here's the twist. Accessing this year's updated COVID vaccine is proving to be a puzzle for many. Imagine walking into your local pharmacy only to be told you're not eligible for the shot, despite having done it effortlessly last year. That's exactly what's happening now, thanks to a major shift in FDA guidelines. But here's where it gets controversial. The Biden administration's health advisors argue this marks a sharp turn from past policies that made vaccines available to all children over 6 months old. So what does this mean for you? You might need to do more than just walk into a pharmacy. Pharmacists may now ask for proof of eligibility, though self-attestation, simply stating you qualify, is often enough. But here's the catch. Some pharmacies still require a doctor's note, and this policy could change once the CDC releases updated recommendations next week. Who qualifies? A detailed checklist. The CDC maintains an extensive list of qualifying risk factors that includes not just age, but also conditions like chronic diseases, asthma, diabetes, heart conditions, neurological disorders, Parkinson's, dementia, immune-compromising factors, HIV, cancer treatment, lifestyle-related risks, obesity, smoking. And here's a surprising twist. Racial and ethnic minorities are also designated as a high-risk group due to documented disparities in outcomes. The FDA estimates this could cover between 100 to 200 million Americans. But what if you're pregnant? While the CDC removed routine vaccination recommendations for pregnancy, major obstetric groups still endorse it. This creates a confusing patchwork where some pharmacies may hesitate to administer shots to pregnant women, even though insurers might still cover the cost. Children in the crosshairs. Parents of young children might feel especially confused. While vaccines are available for kids, the rules have changed dramatically. Moderna's vaccine is now the only one approved for infants as young as 6 months. Pfizer-BioNTech remains for children 5+. Novavax is limited to ages 12+. The irony? Even though babies under 6 months are at highest risk for severe illness, no vaccine is approved for them yet. This is why doctors emphasize vaccination during pregnancy to pass protective antibodies to unborn children. But here's the rub. Parents seeking vaccines for healthy children may still need a doctor's prescription, adding another layer of complexity. The supply versus access paradox. While manufacturers claim there's enough vaccine to go around, access remains uneven. Some pharmacies are fully stocked, while others haven't received their shipments yet. The bigger issue? Many clinics that offered vaccines last year are now opting out, anticipating lower demand. This pushes more people to rely on big pharmacy chains like CVS and Walgreens, which have online scheduling tools to streamline the process. Insurance and cost confusion. Here's a financial landmine. Insurance coverage depends on CDC guidelines. Until the advisory committee meets next week, insurers aren't obligated to pay for the shots. Some are covering them anyway, but others aren't. For families relying on the Vaccines for Children program, help won't arrive until after the CDC makes its final call. And if you're paying out of pocket, expect to shell out $150 to $200 per dose. What happens next? Mark your calendar for September 18th through 19th. The CDC's advisory committee will decide the vaccine's fate. Their recommendations will determine which states allow pharmacies to administer the shot without a prescription, whether the federal Vaccines for Children program includes the shot, how insurers handle coverage. Do you think the current guidelines are too restrictive or just right for balancing risk and accessibility? Share your thoughts below. We're especially curious about parents of young children and healthcare workers with unique perspectives. And here's a final question to ponder. Should vaccination policies prioritize high-risk groups, or should they be universally available regardless of individual risk factors?